Hi there, this is Nursing Education Videos. Today I will be going over the Septic, Shock, NCLEX review on registerednursern.com. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. And again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. So, Septic, Shock, Nursing, NCLEX review for students. In this review, you will learn about septic shock. After reviewing these notes, don't forget to take the quiz that contains septic shock, NCLEX questions, and to watch the lecture. Septic shock occurs due to sepsis and leads to a major decrease in tissue perfusion to organs and tissues. So, in other words, shock, which is where cells are deprived of oxygen due to the lack of perfusion, occurs because of an invasion by a microorganism, septic. According to cdc.gov, 1 in 3 patients who die in a hospital have sepsis. This is a very alarming statistic. Therefore, as nurses, we must be able to recognize the early signs and symptoms of this condition and know what patients are at risk for developing it. What is sepsis? It's the body's response to infection. In sepsis, the response to the infection is amplified and a system-wide inflammatory response is activated. Unfortunately, what occurs throughout the small vessels in the body during sepsis is what leads to the decrease in blood flow, hence tissue perfusion to organs/tissues. Therefore, septic shock is really the end result of sepsis if it's not treated properly and effectively. Septic shock is characterized by the following. This is how you can know if your patient with sepsis is entering into shock territory. Persistent hypotension, less than 90 systolic blood pressure that doesn't respond to IV fluids. Needs vasopressors, for example norepinephrine, to maintain perfusion. A mean arterial pressure greater than 65 millimeters of mercury. This number tells us how well vital organs are being perfused. If it's lower than 65 millimeters of mercury, the organs aren't being perfused very well. Serum lactate greater than 2 millimoles per liter. Remember from our video on stages of shock, we talked about how when cells start to struggle, hence not receiving enough oxygen due to a decrease in tissue perfusion, they will switch from aerobic to anaerobic metabolism. The result of anaerobic metabolism is a buildup of lactic acid in the blood. Therefore, due to a decrease in tissue perfusion, the serum lactate will be elevated. In septic shock, hypotension is not occurring due to a low cardiac output like with some of the other types of shock, for example, cardiogenic shock. It's occurring due to a drastic decrease in systemic vascular resistance due to the vasodilation occurring in the small vessels, along with an increase in capillary permeability and microclot formation in the vessels. These phenomena are occurring due to the body's exaggerated response to the infection present in the body. Now, let's talk about the specifics of why we have persistent hypotension, a decrease in systemic vascular resistance, vasodilation, increased capillary permeability, microclot formation, etc. First, it's important to know that septic shock is a distributive form of shock. Anaphylactic and neurogenic shock are the other two types of distributive shock. What does this mean? It means there is an issue with the distribution of blood flow in the small blood vessels of the body. The alteration in how blood is distributed leads to a limited supply of blood, hence oxygen, to the body's tissues and organs. It's much different than cardiogenic shock because with this type of shock, the heart's cardiac output decreases. Cardiac output is how much blood the heart is actually able to pump per minute. If it can't pump enough blood per minute, the amount of blood flowing to the cells, organs, and tissue falls. The cells can experience hypoxic injury and die. But here, in septic shock, there is a different reason for this decrease in tissue perfusion and drop in blood pressure. It stems from how the systemic vascular resistance is greatly diminished due to major vasodilation that is altering tissue perfusion. Vessels become so large that blood is pooling and not flowing to tissues/organs. Hypovolemia, which is relative, due to the leaking vessels, and this causes increased capillary permeability. Fluid moves from the intravascular space to the interstitial space, so there is a decrease in circulating blood volume. Clot formation in microcirculation. This blocks blood flow throughout the vessels, so blood can't flow to the tissues, hence decreasing tissue perfusion. All of this together majorly diminishes tissue perfusion, hence the development of shock and organ death. Let's analyze how this happens. A microorganism enters the patient's body. It can be a bacteria. Most common causes of sepsis. Well, it can be a bacteria, which is the most common cause of sepsis, and it can be either gram-positive or negative. And then could be viruses, parasites, or fungus. This invasion can cause sepsis. Sepsis leads to an amplified activation of the body's systemic inflammatory response system to fight that infection, and this is system-wide. In sepsis, the body thinks it is helping to attack the microorganism that has entered the body, but really it's failing and causing dysfunction to organs, which leads to septic shock. During this process, chemicals are released by the microorganism and immune cells that will lead to vasodilation, increased capillary permeability, clot formation, and decreased myocardial function. How? The microorganism releases toxic substances that will damage the surrounding tissues. The presence of these substances leads the body to release cytokines and pro-inflammatory mediators to fight and clean up this mess from the microorganism, which makes sepsis worse. These substances will cause the following effects throughout the whole body. The chemicals will lead to changes in capillary permeability, which is blood vessels will leak, vessels will widen, which is vasodilate, and coagulation issues will occur where clots will form within vessels and clotting factors will be depleted. Also, to be released due to this process taking place will be platelet activating factor, PAF. PAF leads to platelet aggregation, which will lead to clot formation in the microcirculation. Remember, these vessels are damaged, and this is system-wide. So, many small clots will form throughout the vessels. This will further block blood flow and lead to a further decrease in tissue perfusion. The problem with this is that it will use up clotting factors and disseminated intravascular coagulation, which is DIC, can occur. Watch for oozing of blood out of body orifices. And if it can't get any worse, the heart's function will become depressed due to the presence of these cytokines, or it could be called cytokines, in the body. especially tumor necrosis factor and interleukin-1. The heart will have a decreased ejection fraction. This is the percentage of blood leaving the heart with each contraction. Due to all of this, organs will have difficulty functioning because their blood supply will be limited. Risk factors for developing septic shock. Remember the mnemonic sepsis. S for suppressed immune system. So AIDS/HIV, immunosuppressive therapy, steroids, chemo, pregnancy, malnutrition. So HIV is human immunodeficiency virus infection, and AIDS is acquired immunodeficiency syndrome. So those diagnosis is under the suppressed immune system. And then E for extreme age, such as infants and elderly. P for people who've received an organ transplant. S for surgical procedures, anything invasive. I for indwelling devices, Foley, central lines, trachs, etc. So tracheostomies. S for sickness, chronic conditions such as diabetes, hepatitis, alcoholism, renal insufficiency. And then the most common sites of sepsis is the GI, so gastrointestinal, abdomen, respiratory, which is the lungs, GU, genitourinary, so the urinary tract. Just want to make sure those are correct. Alright, so GI is gastrointestinal, and then GU is genitourinary systems. Sometimes when you only say the acronyms, you just forget the entire name of the acronym. So, signs and symptoms of septic shock. Early stages, which is the warm phase. Patient is hyperdynamic and compensation is occurring. Warm/flushed skin due to vasodilation. Cool/clammy in late stage. Decreased blood pressure. Hyperthermia. High cardiac output to help maintain tissue perfusion and compensation. Remember, it's not a cardiac output problem, so heart can pump at this point, but it will fail later on. Decreased systemic vascular resistance due to massive vasodilation. Tachycardia. Increased respirations. Lethargic/anxiety. Late stage. Cold phase. Patient is hypodynamic and decompensation is occurring. Skin is pale, cold, clammy. Severe hypotension, increased heart rate, hypothermia, depressed heart function results in low cardiac output and increased systemic vascular resistance, which is vasoconstriction. Oliguria, less than 30 milliliters it's less than 30 milliliters per hour of urine. And then coma. When a patient is having persistent hypotension that isn't responding to fluid, it needs vasopressors to maintain mean arterial pressure of greater than 65 and lactate greater than 2 millimoles per liter, and altered tissue perfusion is occurring. Then the patient is in septic shock. Nursing interventions and treatment for septic shock. Goal summary: increase tissue perfusion, fluid replacement, and then vasopressors if not working. Oxygenate. Greater than 95% tissues need oxygen, and respiratory failure occurs due to acute respiratory distress syndrome, ARDS. Just want to make sure that's correct. Yes, so acute respiratory distress syndrome. And when that happens, the patient which will probably require, or the statement here, which will require mechanical ventilation, fight infection with, so the years brackets, with blood cultures and antibiotics, brackets, and then decrease inflammation. Some patients are candidates for drotrigogen alpha and corticosteroids. Nutrition helps body fight infection, prevent stress ulcers and heals. And then control glucose. This helps body fight infection. Hyperglycemia leads to the altered function in the immune system. To help us remember all the treatment goals and nursing interventions, remember septic shock, the mnemonic septic shock. S for start antibiotics. Need to be started within the first hours of specific shock, or first hours of septic shock. Broad spectrum, used until microorganism identified. Cultures first, but don't delay antibiotics. E for enteral nutrition. Early. This helps maintain gut integrity, helps with healing / fighting infection, and prevent stress ulcers. May need prophylactic drugs like famotidine as well. P for protein activated C. So this is the drotrigogen alpha. Has anti-inflammatory and anti-thrombotic effects. Needs to be started within the first 24 to 48 hours. Watch for bleeding. Note, drotrigogen alpha Zygris is no longer on the market and used in the treatment of septic shock. T for titrate vasopressors to keep mean arterial pressure greater than 65 millimeters of mercury. Norepinephrine would be first choice. It causes vasoconstriction, which increases systemic vascular resistance. This is majorly needed due to the vasodilation occurring in septic shock. Used when fluid replacements are not helping. Fluids replacement is first. The mean arterial pressure is the amount of pressure in the arteries during one cardiac cycle and shows how well vital organs are being perfused. If it is less than 65, organs are not being perfused very well. Inotropics may be added with the vasopressors, such as dobutamine, if there is still low tissue perfusion. C for crystalloids or colloids fluids. First, if not working, then vasopressors. The large amounts of fluid will fill these dilated vessels and refill the depletion of circulating volume. Needs at least 2 IV sites. Warm fluids to prevent hypothermia. Successful would be seen increased blood pressure and / or increasing CVP, which is the central venous pressure, 8 to 12 millimeters per mercury. Double check this one. Yeah, so central venous pressure. And then monitor urinary output, 30 milliliters per hour or greater. They will need a Foley. S for steroids, low dose corticosteroids, used in some patients to help decrease the amplified inflammation, especially if the patient is not responding to vasopressors. H for hemodynamic monitoring, central venous / arterial cath to assess tissue perfusion and filling pressures in the right side of the heart, right atrium, central venous pressure, and then pulmonary arterial wedge pressure, which is the filling pressure of the left side of the heart. I'll double check for that as well. Yeah, so that's correct. Pulmonary arterial wedge pressure. So O for oxygenate. Keep oxygen saturation greater than 95%. Tissues need oxygen. Many patients will experience respiratory failure, which is ARDS, so acute respiratory distress syndrome, and will need intubation with mechanical ventilation. C for cultures. Blood, wound, urine, etc. Obtain the cultures before antibiotics. K for keep glucose less than 180 milligrams per deciliter. May need insulin drip. The immune system is affected by hyperglycemia. And then other. Check lactate levels. If patient needs vasopressors to keep mean arterial pressure greater than 65 millimeters of mercury, even though fluid replacement has been given and lactate level is greater than 2 millimoles per liter, think septic shock. And then Foley insertion. Strict input and output. UOP will help you assess tissue perfusion and if kidneys are being perfused well. So UOP is urinary output. UOP should be greater than 30 milliliters per hour. References for this information: Center for Disease Control and Prevention, 2017. Protect Your Patients from Sepsis, ebook, page 1. Retrieved from www.cdc.gov/sepsis/PDFS/HCP_YOUR-PATIENTS-FROM-FS08.pdf. And then the next reference, sepsis, SEPSIS 2018, retrieved from www.education.nih.gov/education/facts_sepsis.aspx. And then the next reference here is, what is sepsis? Question mark. Healthcare Professional Materials, 2017. Retrieved from www.cdc.gov/education/education/resources.html. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel. I hope everyone has a good day. Thank you.